A challenging location. Kokroko, located in the Techima North District of the Bono East region, is primarily agricultural in nature. Poor roads, no health center. It's common for pregnant women and other patients to travel on dangerous roads to see a doctor in the next town, about 45 minutes drive away. Every time it rains, things get worse. A pregnant woman bowed in agony. Ajwa Kosa, age 21, is a mother of 3 and is 6 months pregnant. She has a headache, but sadly, there's no health center around. Ajwa was able to walk to the only bus stop in the area, but there were no cars. Due to the terrible nature of the roads, vehicles do not come here often. She returns home, hoping that the pain calms down.
We have a clinic, but it's yet to function. I would have gone there for a checkup, but my head aches. It's difficult to get a vehicle because of our poor roads.
Ajwa has only attended antenatal care 4 times in the past 6 months. She delivered her second child at home.
I was in labor at night and there was no car, so I delivered at home.
Jama Frida is 8 months pregnant. She tells me she bled the day before after plying the road from Wenchi, a neighboring town, to see her mother.
I
bled after plying the road, but I went to the hospital for checkup the next day and I was told my baby is okay.
Jama is contemplating going back.
Because I
don't wish to give birth here. The thought of it scares me.
Seidu Amwako is the only driver who frequently travels here. He tells me a woman once gave birth in his car.
A lady gave birth in my car whilst we were on our way to the hospital. The roads are our biggest problem.
A local farmer, Patrick Kosa, informs me that getting a car in an emergency situation is challenging.
Because of road the
only clinic in the area is yet to be operationalized. I am not in the middle of the bush somewhere. This is actually a path that leads to the Kokroko Community Clinic that has been abandoned for 6 years, according to the residents here. Now, due to the abandonment here, you can clearly see the grasses that have grown to a very higher length, covering up the facility. Even if you are the other side of the road, you cannot get to see this particular facility. Now, I've been told by the residents here that there is no single health facility here. The people here in Kokroko cannot boast of a single health facility. According to some residents here, some women who are always in labor struggle to get to the next community, which is about 45 minutes. Some of them deliver on the way, and for some others, they lose their babies, which is really heartbreaking. I can clearly tell you that this facility is deteriorating. There are cobwebs all over the ceiling, and the doors are rotting away. Every part of the building is eaten away. It is deteriorating. And when I actually peeped through the windows, I wanted to see if there are some health equipment in here. And trust me, I can see some hospital beds, delivery beds, there are fans on the ceiling. This is actually a facility that could have started to sustain patients who come in here. But this entire space has been abandoned, and residents here do not have access to quality health care. Most women in labor in this area are attended by a traditional birth attendant. She has been called to attend to a lady in labor. After some checks, Abiba Bukari could tell time for delivery is almost due.
I say, Hano, I can say, I
can feel the baby's head. It's gradually moving down the abdomen, but she's not due yet.
The 55-year-old has delivered over 100 babies successfully in Kokroko.
Sometimes complications set in when I'm attending to delivery. Our roads should be fixed.
The Aurora Health Center, which is few miles away from Kokroko, has provided her with gloves and other materials to aid her work.
One of the things that Ghana Health Service is trying to prevent is to prevent home deliveries. We want to record 0 home deliveries, that every pregnant woman is attended to by a skilled midwife. So if we have one of our communities here who is still recording home deliveries, then it's worrying.
He's worried because women deliver preterm due to not coming to antenatal care. Some of the babies come with complications.
They are not able to come for ANC early and often because of the road network. So by the time they will deliver, we have a lot of babies who are not healthy because they didn't attend ANC regularly.
Kronte Hene of Kokroko, Nanakosa Akore, is worried about the deaths of new babies in the area.
We use a motorbike and then carry the pregnant woman to the nearby hospital. During the delivery, the child may be also lost, so it's a big headache.
Since this is not a government project and it's for the Methodist Church, you cannot push them because this is not their responsibility, if you ask me. Okay. They have gone out of their own way to do it. It is the government of Ghana that has the responsibility of taking care of our health needs. Okay. This government is not interested in providing health facilities for our people. As I speak to you right now, even Techima North does not have a district hospital.
Efforts by the Ghana Health Service to provide quality health care to the people of Kokroko are being hampered by the deplorable road networks and lack of health facilities. We came across a car parked here for 2 days.
The roads are terribly bad. My car has been badly damaged.
The bad roads are adversely impacting on healthcare delivery, and therefore government must, as a matter of urgency, fix the roads in the community and open the abandoned health center to save lives. Godwin Asidiba, TV3, Kokroko, Techima North, Bono East Region.